You can always experiment. Pero nakakatakot kasi like but of course we cannot blame them naman yung mga nasa networking ng mga rejuvenating set, 'di ba? The more na nabebenta nila, the more na kinikita, talaga gumaganda pa sila. There are a lot of ano naman, especially endorser nila si Marian Rivera, kinis-kinis, ang ganda-ganda. But still, meron kasi siyang adverse effects na kung minsan when they stop using this rejuvenating set, nangingitim na sila, lumalabas na nila ang acne. And that's the only...
Hey everyone, I'm Dr. Kristine Alba Kiat, and this is Chat with Peds, where I interview experts in the field in order to empower you and give you the confidence to raise happy and healthy kids. My guest is a colleague and a good friend, Dr. Louella Ramos. She is a board-certified dermatologist of the Philippine Dermatological Society, and she's also the chairman at Southern Isabela Medical Center, Department of Dermatology and Venereology. She's a wonderful resource for any questions I have about my patient's skin and my skin as well. Join me as I welcome Doc Ola. Hi, Doc.
Hi, Teen, and hi everyone who's watching the YouTube channel of Dr. Kristine Kiat.
Yeah,
Thank you for inviting me. It's an honor to be part of your show.
You're so busy. It's so hard to catch you, Doc. So I'm so glad matutuloy na tayo. So, Doc, what are your acne prevention tips for the audience? Like how to take care of one's skin or may skin regimen ba from a board-certified dermatologist, Doc?
Ako, lagi tatanong niya, what is your secret? It's actually not a secret. Pero di ba, basic skincare pa din talaga. Yung pinaka-basic is you always have to clean your face. Kung wala ka naman masyadong problematic issues, like you really don't have those acne, a mild cleanser will do. But sometimes if you have acne, pwedeng na-i-incorporate na sa facial wash the other medications like glycolic acid, meron salicylic acid wash, meron din benzoyl peroxide wash. Ngayon, meron na yung mga nakaka-lighten, niacinamide wash. So it depends on the characteristic of your skin. Kung oily ba yan, kung nasa dry side ba yung skin mo. So your cleanser you should adapt your cleanser to your type of skin. Okay? Ngayon, depende ninyo, like I'm sure nakikita nyo na yan in it's social media, 'di ba? Cleanser, ano yun, 7 steps. Okay? Pero may apologies, never yata ako naka 7 steps. But for me, the basic,
masyadong commitment.
diba? Mga toner, that's okay. For me ako, okay lang naman yun as long as you don't have problems after. Ang isang dito in the region sa Cagayan Valley, especially Isabela, ang talagang ina-advocate ko is the use of sunscreen. Okay, so we don't use the word sunblock anymore kasi hindi naman natin pwede i-block si sun. So we just call it sunscreen. It's a more politically correct term, si sunscreen, okay? For actually whatever age, especially yung mga bata who start using treatments na for acne, I encourage them na to start using sunscreen. Kasi what are the effects of a sunscreen? It screens, okay? It screens or it protects your skin from the damaging effects of the rays of the sun. So, to encourage yung mga patients to wear sunscreen, I tell them that it's actually one of the best anti-aging creams. O, di ba? Pag sinabing anti-aging, that's a magic word. Paano anti-aging si sunscreen? Ginagamit ko lang yan pag nag-swimming. So, the proper use of sunscreen is actually one of the best skincare investments that you can have, di ba? Kasi the damaging effects of the sun, the rays of the sun, the UVA, so you actually, para maano natin, mas madali natin matandaan, UVA actually causes skin aging. So A, yan yung pinaka nagka-cause ng skin aging. So it reaches down to the dermis, nalalampasan pa niya, pumapasok siya sa loob ng skin natin. Okay? While UVB, it's what causes burning, sunburn. So kung bigla ka nilang maitim, it's because you had too much exposure to UVB. Yung UVC hindi na kasi umaabot sa skin ng tao. Hanggang dyan lang siya sa ulap-ulap ng ating mundo. Okay? So, but the combination of your UVA and UVB both causes skin cancers. So, yun yung C natin. Pero, both UVA and UVB. Now, UVA, it causes aging in the form of mas nagpo-form ka ng wrinkles, mas na-damage kasi niya kasi 'di ba nasa dermis yung effect ni UVA, and it also causes hyperpigmentation. Bigla na lang nag-iitim-itim. So that's why it's very important to tell our patients it's a good part of an anti-aging regimen ang sunscreen. Whether you're using a bleaching cream or not, or you have your own regimen, kailangan naka-sunscreen pa rin. So more so kapag gumagamit ka ng mga whitening agents. Kasi when you use whitening agents, when you apply it to the skin, para pinaninipis mo yung skin. You make your skin cells more vulnerable sa effect ng UV rays ng sun. So dapat mas ano na naman tayo dyan. So really sa mga patients ko, I advocate using sunscreen. And not just having the right sunscreen. Ngayon talagang mas high-tech na yung mga sunscreen natin, mas updated na siya. You don't have just this SPF number. Kasi the SPF number is your indicator of protection against UVB. But pag napansin mo ngayon, meron yung PA++ or PA plus 2 plus 3, parang ganun. That's an indicator of your protection for UVA. Before, nakalagay lang broad spectrum. That's okay. Pagka titignan mo, dapat merong broad spectrum. It means you have protection against UVA and UVB. Pero ngayon, nilalagay na rin nila na other than the SPF number, you have the PAA+. And it's also a matter of consistency in wearing your sunscreen. Daily, di ba? Daily siya. Kasi I always tell my patients, hindi lang kapag nagsuswimming lang or hindi kapag lalabas ka lang. It has to be, kasi araw-araw naman dyan naman yung ating araw. Lumalabas ang araw. Kahit nasa loob ka lang ng bahay, there are UV rays that gets inside your house, di ba? Nagre-reflect pa din siya. So you have to wear it every day. And then the time of the day that dapat meron kang coverage is 9 a.m. to 3 p.m. Sa iba, it's 10 a.m. to 2 p.m. Pero ako sa Isabela, ginagawa ko sa pasyente ko, 9 a.m. to 3 p.m.
Nice.
Di ba? Kadalas 4. Oh, ang init na eh. Pag inisip mo, so every day. And other than those things, so yung type of sunscreen, time you have to wear it, and the frequency every day. And one of the most important, you should have total coverage of the face and neck. Sabi sa book, 1 teaspoon of your sunscreen, buong face and neck. So, paano mo naman yun i-measure every day, di ba? So, this is how I advise my patients. So, i-dab-dab mo siya sa buong face and neck. Always include your neck. Kasi kung minsan pumuputi yung mukha dahil hindi nga yan napapaitim, di ba? Tapos, yung neck mo mas maitim. Okay. Isasama mo yan. Tsaka, syempre, nag-i-age ang ating neck. So, kailangan kasama si neck. Okay? So what I usually do at advise my patients is that i-double coat mo siya. Okay? You apply on your whole face and then you put another layer. That way, you're sure na all areas of your face and neck are covered. Kahit hindi ka nag-measure na may 1 teaspoon, may half teaspoon na ba to. Yan. And it's very important na for you to find yung hiyang ka na sunscreen, di ba? Like yung iba masyadong ano to? Yung masyadong creamy sa face or yung iba nagkikake or malagkit, mahapdi. Yun, pwede rin. Some would have a mahapdi na feel. Oo. Tapos ngayon kasi ang high-tech na ng mga ano natin, like the one I use, meron na siyang concealer. So, if you really have hyperpigmentation, kasi 'di ba, meron na rin talaga. For doctors, especially those in the cutting fields, mga surgeons natin, I always advise them, 'di ba, our surgeon friends, magsa-sunscreen pa din kayo pag nag-OR kasi your indoor lights emits UV as well. So, 'di ba, tagal-tagal mo nandiyan, tataka sila. So, even as dermatologists, when we do laser procedures, we make sure na kasi nagba-bounce back pa din yun. There's a certain percentage pa rin of those laser lights na nagba-bounce back sa skin natin. So ayan, ganyan talaga ako ka-advocate ng sunscreen.
Aha,
Wag na
aha.
kayo, kahit hindi na kayong gumamit ng mga whitening agents, just make sure that you're wearing the proper sunscreen and you're wearing it correctly.
You know what I've
What
learned,
do you-
Doc, sa tips mo? Number one, use sunscreen. Number two, it's best pa rin na kausapin ng dermatologist para ma-tailor fit yung skin regimen sa'yo. Kasi ako, Doc, nung nakausap ko kayo, parang, oo nga, no?
Diba?
Iba pa rin
Oo
pag
naman.
naayos ang skin regimen at na, ano, at ako kasi minimal lang eh. So, okay din.
You can always experiment. Pero nakakatakot kasi like but of course we cannot blame them naman yung mga nasa networking ng mga rejuvenating set, 'di ba? The more na nabebenta nila, the more na kinikita, talaga gumaganda pa sila. There are a lot of ano naman, especially endorser nila si Marian Rivera, kinis-kinis, ang ganda-ganda. But still, meron kasi siyang adverse effects na kung minsan when they stop using this rejuvenating set, nangingitim na sila, lumalabas na nila ang acne. And that's the only time they come to our clinics or consult us. Nagagamot naman. But sometimes may mga conditions which are really hard to treat. But you just prevent na lang yung pag-worsen ng mga skin condition. Yung paglala ng pag-itim or paglala ng acne nila brought about by using those mga rejuvenating set. Baka mamay magalit sa akin.
It's true, Doc. I see patients in clinic na nag-react, tapos pinapa-refer ko sa derma. Kasi, oo,
Oo. Oo,
yeah,
dapat talaga that's the best time that they should come to us sa mga dermatologists.
yeah, thank you. So, Doc Ola, for patients who want to reach you, how can they reach you?
Yes, actually Mondays to Fridays, I'm at the Southern Isabela Medical Center, Department of Dermatology and Venereology. We actually have our dermatology center there, and we have a lot an array of treatments if you have for your dermatological needs. Hindi lang acne, actually marami po. We have a wide range of services for your needs, not just the aesthetic po ha, but your pathologic diseases. We cater to them. And on Saturdays pala, Saturdays sa Matbay Private Clinic at the Heritage Building, Room 216, every Saturday afternoon lang po. And if you have quite urgent needs and would prefer to have an online consult first, you're free to check out the Facebook page of our department. Just type in at SIMC, capital letters SIMC, capital letter D, and then small letters ERMA for our page. And we would gladly answer your queries, your teledermatology questions. So that's at SIMC Derma. That's our page.
All right. Thank you, Doc Ola, again.
Thank you, Tin.
Bye.